I'm George Godlewski. I'm the Vice President for our psychiatric services at the Geisinger Health system in Pennsylvania. At Geisinger, we have for the past decades worked very hard at creating an atmosphere of coordinated, comprehensive, and integrated care across our system. That applies to all specialty services throughout our system. We are spread across a broad geography in Pennsylvania, tremendously rural in areas and characterized by small towns, small industry, and an aging population in Pennsylvania. For our psychiatric services, we have accomplished a tremendous amount of integration with medical specialties, participating with oncology, women's health, pediatrics, palliative medicine, and pursuing a view of the person as a whole person. We provide psychiatric services across the spectrum of age, across the spectrum of services and disabilities and diagnoses. The issue with our E&M codes is that to reduce the payments as proposed is going to tremendously impact a very vulnerable group of patients. It will certainly create unnecessary human difficulty and human struggle. But on the healthcare delivery side, we currently are able to protect those patients, to serve those patients in an outpatient basis, allowing them to be in the community. We avoid unnecessary emergency room services, and we avoid readmissions for our psychiatric patients. In addition, because we are involved with medical specialties, we can assist with specialty medical care and reduce the costs related to health care for the psychiatrically ill patients. Without our services, I fear that we will see a tremendous number of patients relying only on the emergency services for their psychiatric care, and that will result in human difficulties, human sufferings, and in the long run, a tremendous increase in costs related to inpatient utilization. One of the things that we have experienced over the last several years is a reduction in the access for Medicare patients to our community psychiatric colleagues. That has resulted in more Medicare patients seeking care at the Geisinger outpatient psychiatric services. We have become essentially, for many communities, the provider for Medicare patients. Our psychiatric services exist really because of our belief in comprehensive care. Annually, we are a money loser in the Geisinger system if you cause psychiatry to stand independently. But because we treat people and look at the human being and health in a comprehensive, integrated way, we are supported by the system to continue to provide psychiatric services so that we can build that integrative and innovative care for patients and the communities that we serve. If we were to further erode the financial picture for psychiatry at the Geisinger system, we may be in a position to have to make decisions about the scope of services that we actually are able to deliver.